not touch your face. In this video, I would be talking about what acne means, the causes of acne, triggers, do's and don'ts, and because I also suffer from this condition, what I've been able to do and things I know have worked for me or haven't. Yeah, let's get right into it. Acne is a chronic inflammatory disorder of the skin. It is aggravated by a bacteria called Propionibacterium acnes. I'm gonna drop it there because I'm sure some of you are going to make it your life's work to learn the pronunciation of that bacteria. Anyways, acne occurs as a result of the hypersensitivity of the sebaceous glands in the skin. What this means is there's an excessive production of oil in the skin. Acne affects males just as much as it affects females. So when you see your male friends or your brothers having acne, they could have it just as bad as females or even worse. The common parts of your body where you'd find acne are generally your face, your deltoid region of your arm, that's the upper arm right here, and then your back, the upper part of your trunk. Let's move right to the causes and the triggers of acne. So acne can be caused by genetics. This means it runs in your family. Probably your mom had it, or your dad had it, or your siblings had it. Yeah, it could be caused by pregnancy. It could be caused by hormone changes, especially for females that deal with PCOS, polycystic ovarian syndrome. It could also be caused by some medication and also excessive sunlight. The triggers are diets. I'm sure we love our milk. I'm sure we love our dairy products. I'm sure we love our chocolates. I'm sure we love our nuts. But these are some of the things that need to be avoided. I'm sure if you suffer from acne, you've already noticed like some of the things that could trigger a flare up. We have premenstrual syndrome. Yes, your premenstrual symptoms. So before you're on your period or while you're in your period, you notice that you have these flare-ups of acne, but you're sure like they might resolve after you're done with your period. Stress, yeah, anxiety, anger, these things lead to an increase in your stress hormones and they aggravate your acne. Avoid stress by all means. I know life could be stressful, but you need to work on ways to manage your stress to reduce your acne. And also facial massages. Be careful where you get those facial massages. I'm sure you want to be on fleek and someone told you try this, try that, but be very careful, you know. Always start with a small part of your skin so you can see if you've got reactions to things before you try it on your full face or over your full body. What else have we got? We've got oil-based products. I'm not talking about you making soup or stew and then you go and pour 500 milliliters of oil in your food. That's not what I'm talking about. I'm talking about things like your foundation, things like your product, things you put on your skin. Africans and Asians are more commonly affected by acne, and we as blacks, we are more prone to having hyperpigmentation. So when you look at your skin and you've got this lesions or patches that seem darker, I don't know if you can say it, patches that just seem darker than your normal skin, that's hyperpigmentation. And if you've got like lesions that are lighter than the other part of your body or your face, that's hypopigmentation. And then there's something about acne. While it heals, you might think, oh yeah, I'm getting saved, it's reducing, blah blah blah. You could have scars. Yes, you could have scars, and these scars could be depressed scars. When I mean depressed, it could be like deep pits. So just look at my face right now and imagine I've got just a deeper part that's pressed. That part of the skin is pressed. That's called a depressed scar. And you could also have like thicker scars, like when you have a cut or you have a surgery, like hypertrophic scars or keloidal scars. You could also get those. Let's say you've got acne, you can see it, it's either on your face, on your chest. What do? You have to go see a medical professional. I'm saying medical professional, and I'm not saying someone, because right now there are so many people that seem to think they know a lot about skin just because they use certain products and it works for them. Please don't go to anyone who doesn't have a license to practice medicine and isn't a dermatologist. Yes, I said it. You need to go see a dermatologist. These are people that are specialized in skin and skin conditions and their treatments, so they know what would work for you, or at least they would try to give you things that would work for you. And even if these things do not work, they can give you other alternatives. This brings us to your treatment options. So there are topical treatments. These are things that you apply over your skin, and there are also systematic treatments. So systematic in the sense that you take it via your mouth, or you take it as an intravenous treatment, like something that passes through your veins. But generally for acne, no one is giving you like drips or anything through your veins. Like it's mostly either oral or topical. So your treatment options are antibiotics, because in the beginning of this video, remember I said there was a bacteria that could aggravate your acne. So in order to counter the effect of this bacteria, you're giving antibiotics. Something else you can use would be vitamin A. Those are retinoids, and I'm not going to mention names or anything. Do not touch your face. Do not touch your face. Do not touch your face. When you wake up in the morning, that should be something you tell yourself. Avoid mirrors at all costs. Like, do not find yourself standing in front of a mirror, because I know it's a temptation that's hard to avoid as someone that deals with acne. Don't touch your face. Use sunscreen. Sunscreen helps with your hyperpigmentation. It also protects you from sunlight. Use sunscreen. Always use sunscreen, and you have to use sunscreen a couple of times in a day, not just once in the morning and that's it. No, you need to continually reapply it. Okay, drink water. Drink enough water. Drink more than 1.5 liter of water every day. It helps, not just for acne, for everything. Water is very important. Like I said before, change your diet. Avoid things like milk, avoid things like granules, avoid nuts in general, avoid chocolates, avoid junk food. I know this is difficult, because trust me, it's hard for me too, but you know what triggers your acne, you know what you take that affects your skin. Just try to avoid those things. Even if you cannot completely avoid it, reduce the rate at which you take them. Wash your face, preferably in the morning and at night. Some people wash their face once, but as someone with acne, you need to learn to wash your face twice. And then stress. Manage your stress. Please manage your stress. Please don't try things because your friend is trying it. Don't try things because people recommended it to you. Things for acne prone skin are not the cheapest. They're expensive. I understand. So please do not try everything you see. Go seek medical help, and whatever they tell you to get, use it, and use it consistently, and you see that things will begin to change. Like, all it needs is patience. Be patient with yourself, be patient with the treatment. Everything will be fine. My face used to be way worse than this, way worse than this, and it's getting better now. I try as much as possible to avoid makeup because I know then I have to clean things, then there's residue left, and I just try to avoid makeup in general. I look for things that work for you and stick to it. Stick to it, okay? I hope in this video I've been able to help you in some way. If you like this video, like, comment, subscribe, tell your friends about it. Thank you for watching my video. I'll see you in my next one. If you've got any recommendations for me, please don't forget to comment below, and I'll be sure to say and respond to you. Bye.